Hey guys, this is Chinka, volunteer at Jitendra Foundation, and today we have Dr. Sanjay Soni with us for another medical session. So, before I just brief about the medical session, I would request Doctor to please introduce yourself.
All right. Thank you so much, Shinka, for the opportunity. I'm Dr. Sanjay Soni, MBBS. I've done my MS ENT and then DNB in ENT. And currently, I'm in Loknayak Hospital, Delhi. I'm practicing as a senior resident. And today's session is going to be about common conditions in ENT that pertains to all of us and how we can manage them, how we can take care of ourselves with those conditions, and also how can we raise awareness in the society about those conditions and actually help the people who need us help, who need our help the most, right? So yeah, let's get on with it.
So, as you mentioned, the just to brief the viewers, the session is gonna be majorly on ENT. Basically, how the kind of common awareness that we should all should be having. And thank you, doctor, for being on our show. Or
Most
being,
welcome.
yeah. So I think first let us start with maybe the common questions that we usually get in our minds. What do you think? What is the frequency of getting our ENT parts checked or examined usually?
The frequency, right?
Yeah.
Or the All right. So ENT diseases which pertain to ear, nose, and the throat, the oral cavity, हिंदी में बोले तो मुंह और गले की दिक्कत. It is very common. It is very very common in the general population, and the problem is we don't know how to take care of them properly. A general person is sort of ill-equipped. वो कभी कभी अपना ध्यान खुद से नहीं रख पाते हैं. उनको प्रॉपर जानकारी ना होने की वजह से they keep on ignoring it, and only when the problem becomes huge, जब वो बहुत छोटी सी चीज से बहुत बड़ी बन जाती है, only then उनको समझ में आता है, उनको रियलाइज होता है कि हमें शायद मेडिकल अटेंशन चाहिए, और तब वो पहुंचते हैं, और बाय दैट टाइम यूजुअली इट्स क्वाइट लेट, और जो इतनी सी चीज है वो इतनी बड़ी हो जाती है. तो वी हैव टू टेक केयर दैट वी अंडरस्टैंड दीज थिंग्स एंड वी कैच देम एज सून एज पॉसिबल.
तो इसमें एक क्वेश्चन दैट आई वाज अबाउट टू आस्क, ये जैसे वी हैव इन द डेंटल एरिया दैट यू गेट योर टीथ एग्जामिन्ड वंस इन अ मंथ, और ऐसी कोई फ्रीक्वेंसी होती है दैट वी हैव टू गेट आवर स्पेशली द ENT एरिया एग्जामिन्ड?
Right. So if you are asymptomatic, if you do not have any symptoms or any other issues, there's no hard and fast rule. You can always get it checked in within 1 year or 1.5 years. But if you have any pertaining conditions, like you have any sinus condition, or you think you are having some sort of distorted hearing, or there is some lumpiness or something sticking in your throat, ऐसा लग रहा है गले में कुछ अटका हुआ है, बार बार हम खट्टी डकारें आ रही हैं, या अगर ऐसा कोई भी इशू लग रहा है, then you should have it checked as soon as possible. Also, it is of special importance in newborns. Why? छोटे बच्चों में hearing possible, कभी कभी छोटे बच्चों में hearing का इशू होता है. For example, I mean, there is a thing called congenital deafness, मतलब बचपन से बहरापन, जन्म से बहरापन. So इन बच्चों, जैसे हम नॉर्मल बच्चे को अगर बुलाते हैं उसके नाम से, तो 6 महीने के बच्चे को या 4-5-6 महीने के बच्चा would usually turn his head towards the source of the sound. आप बच्चे के पीछे जाके उसका नाम पुकारेंगे, वो मुड़ के देखेगा, या अगर खिलौने की आवाज करेंगे, वो मुड़ के देखेगा कि आवाज कहाँ से आ रही है. अगर ये कैरेक्टरिस्टिक बच्चा नहीं कर रहा है, अगर बच्चा किसी भी साउंड को रिस्पॉन्ड नहीं कर रहा है, that means कि there is some deficiency in the hearing of that child, and that needs to be corrected. Why? Because आप जितना जल्दी उसे ठीक करेंगे, उतना ही ज्यादा चांसेस हैं कि वो ठीक पूरा हो जाएगा. आफ्टर अ सर्टेन एज, अगर हम बीमारी को टैकल करना भी चाहें तो भी टैकल करना बहुत मुश्किल हो जाता है. सो 2 साल तक हमें मैक्सिमम कोशिश करना है कि हम ऐसे बच्चों को ठीक कर दें, पकड़ के ऐसे बच्चों को डायग्नोस करके, स्क्रीन करके, और उनको हम वी कैन करेक्ट देम. सो वी डू नॉट हैव टू वेस्ट टाइम, दैट इज ऑल.
तो मतलब बेसिकली व्हाट वी अंडरस्टैंड इज कि बच्चों में इट इज़ कॉमन, सो वी हैव टू कीप नोटिंग द सिम्टम्स. एंड
यस, इन चिल्ड्रन, इन एल्डरली, जो अडल्ट होते हैं, जिनमें जो बुजुर्ग होते हैं स्पेशली, जिनमें हियरिंग में इशू होता है, उनमें, एंड इफ यू हैव एनी पर्टिकुलर कंडीशन, देन यू कैन ऑलवेज विजिट विद इन 6 months for a routine checkup. Otherwise, there's no need.
Okay. And since you had been practicing in this industry, you have been actually. So, are there any common misconceptions or myths or confusions that you come across?
Uh, there are a lot of misconceptions going on, which are quite prevalent in the society.
Mm-hmm.
और ये misconceptions ऐसे हैं कि society के हर तबके में है, हर level पे हैं. Even the most educated ones, not just the uneducated ones or the labor class, even the most educated ones have these kind of presumptions or myths. So number one is, for example, कि कान में अगर कुछ भी होता है तो they go and put ear drops, oil. They go and put oil in the ear, which is absolutely a wrong practice to do. Putting oil in the ear, कान में तेल डालने से इन्फेक्शन और कान के अंदर जाता है या बाहर का इन्फेक्शन कान के अंदर जा सकता है. उससे कुछ खास फायदा या नुकसान नहीं होता. हमारा बॉडी तेल डालने के लिए नहीं बना है. ऐसा नहीं कि हम we use it unnecessarily. Number two, we use earbuds to clean our ears, right? So हमारी बॉडी ऐसे बनाई है नेचर ने या भगवान ने किसी ने भी कि the wax which is in the ear automatically comes out. There is no need to take the wax out by yourself in majority of the cases. Also, जो wax होता है, it is actually very very good. It provides a local antibiotic action. It prevents any external thing to go inside. It acts as a barrier, ताकि जो wax होता है वो हमारे कान के जो हमारी कनाल होती है, ये एक्सोनोटरी कनाल, इसी में wax पाया जाता है और ये wax रोकता है किसी भी चीज को अंदर जाने से. नंबर 3, जिन लोगों में हियरिंग एड एडवाइस होता है उनको ये एक मिसकंसेप्शन होती है कि हियरिंग एड लगाने से उनकी जो बची हुई हियरिंग है वो कम हो जाएगी या खत्म हो जाएगी. ऐसा बिल्कुल भी नहीं होता. हियरिंग एड्स आर फॉर दोज पीपल हु कैन नॉट हियर. Like this is simply for example, they equate to something as simple as a spectacle or a glass that we wear, right? तो जब हमारी आंख कमजोर हो जाती है तो हम चश्मा लगाते हैं. आई थिंक विल ऑल एग्री. एंड इन द सेम वे जब हमारी सुनाई की नस कमजोर हो जाती है या सुनाई कमजोर हो जाती है तो वी शुड ऑलवेज गो फॉर अ हियरिंग एड. उससे सुनाई पे कोई भी फर्क नहीं पड़ता. अनदर मिसकंसेप्शन इज, अगर मैं नोज की बात करूं तो कभी कभी पीपल से दैट अगर आपको ब्लीडिंग हो रही है नाक से तो आपको लेट जाना चाहिए, विच इज नॉट ट्रू. ब्लीडिंग लेट जाने से नहीं रुक जाती. अगर ब्लीडिंग होती है तो हमेशा नोज को पिच करके हमें आगे की तरफ फॉरवर्ड, वी शुड बेंड फॉरवर्ड्स, हमें आगे की तरफ झुकना चाहिए इंस्टेड ऑफ लाइंग डाउन. पीछे नहीं झुकना, आगे की तरफ झुकना है, नोज को टाइटली ऐसे पिंच कर, राइट? ऑल्सो in ENT, in the oral cavity, we encounter cancers. We can encounter cancers of the buccal mucosa, cancers of the oral cavity. तो मुंह का कैंसर. और हमारे कंट्री में oral cancer is the number 1 cancer in the country. Okay. In India, oral cancer is the most common type of cancer that we see. So it is very very common, and of course the risk factors किन चीजों से होता है उसमें टोबैको कंजम्पशन, तंबाकू खाने से या सिगरेट पीने से या अल्कोहल से. ऑल्सो एक मिसकंसेप्शन ये होता है कि जब हम ट्रीटमेंट करते हैं किसी भी कैंसर का या किसी भी ओरल कैविटी में किसी गांठ का, तो उस ट्रीटमेंट प्रोटोकॉल में हमें एक छोटा सा टुकड़ा लेके भेजना होता है जिसे हम बायोप्सी कहते हैं. Taking a biopsy means taking a very small bit of that specimen and then we send it to know the exact type of thing, the exact type of disease that it is. और कुछ में एक मिसकंसेप्शन ये है कि अगर हम बायोप्सी लेते हैं तो डिजीज बढ़ जाती है. ऐसा नहीं होता. बायोप्सी लेने से डिजीज कभी भी नहीं बढ़ती. रादर वो एक प्रोसेस है जिससे हमें डिजीज पकड़ में आती है. ऑलराइट. देन फॉर कैंसर्स ओनली देयर इज अ मिसकंसेप्शन दैट कैंसर का इलाज नहीं हो सकता, विच इज एब्सोल्युटली रॉन्ग. अगर हम सही टाइम पे आ जाएं, अगर हम सही टाइम पे सही जगह पहुंच जाते हैं तो इट इज वेरी इजी. दीज डेज वी हैव एडवांस्ड मेडिसिन्स, एडवांस्ड इंस्ट्रूमेंट्स, एंड द एंटायर the disease can be taken out completely and we can completely get rid of it, and after that the person can live a life as normal as you and me. That is one of the misconceptions. Also, we think that cancer can only occur in smokers or in people who chew tobacco. It is not true. As in 97% of the times it occurs in people who are addicted to something, but 3% of the times it can occur in those people also who do not consume these things, right? There are genetic factors. Genetic factors होते हैं जो actually predispose करते हैं किसी को इस चीज के लिए. ऑल्सो एनवायरमेंट के फैक्टर्स भी होते हैं. तो एक मिथ ये है कि सिर्फ स्मोकिंग या टोबैको वालों को होता है, ऐसा नहीं होता, उसके बिना भी हो सकता है. ऑल्सो एक झाड़ फूक, एक कॉमन मिसकंसेप्शन ये भी है कि आप झाड़ फूक अगर करा लें तो, या कोई आयुर्वेदिक या कोई और ट्रीटमेंट ले लें तो आप इसको कंट्रोल कर सकते हैं. ऐसा बिल्कुल भी नहीं है. कैंसर का ट्रीटमेंट पूरे वर्ल्ड में एनसीसीएन गाइडलाइंस के हिसाब से होता है. एनसीसीएन, it's a guideline which is followed by all the countries, be it America, be it UK, be it Australia, be it Canada, anyone. And उसी के बेसिस पे हम भी ट्रीट करते हैं. तो the most important time in this is time factor. Most important thing is time. अगर आपने सही टाइम पे सही जगह दिखा दिया तो there is a very high possibility that actually it will benefit you. And if not, if you lose time, then so it becomes difficult. Also, it is not something जो छूने से फैल जाए. It is also, मतलब this has been asked to me by my patients कि सर क्या हम अगर उस पेशेंट के साथ में सेम रूम में रहेंगे या अगर उसको हाथ में लगाएंगे तो हमें ऐसा होगा? ऐसा बिल्कुल नहीं. It is not a communicable disease, right? And apart from that, I think, I mean, these are the common misconceptions that are there. And yes.
I think just this, the point that you said about communicable disease. तो यही चीज़, I think the next question that I was about to ask was, अगर if we get to know कि किसी को they have problem in their ear, nose, throat area में कहीं पे चीज़ें है,
Yes.
तो what do you think, हमें what are the things that we can do, contact करना है नहीं करना, what are the different things that you can guide, from my perspective, let's say, if I encounter somebody who is kind of dealing with these problems from mild to intense, ठीक है, बट कोई भी उसको प्रॉब्लम हो रही है तो उसमें मेरा क्या रोल रहना चाहिए एज अ सोसाइटी, और उस बंदे को
Okay.
या द पेशेंट, उसको क्या चीज़ों का थोड़ा बहुत ध्यान रखना चाहिए.
Definitely. So first of all, our role as a society should be to guide the person at the right place at the right time. I mean, we should encourage them to visit a proper ENT hospital at the right time. It is very important, right? We should encourage them कि आप जाओ. Number 2, हमें उनको ये बोलना चाहिए कि आप ये कोई भी जो नुस्खा है या ये जो हम हल्दी और ये सब जो नॉर्मल चीजें करते हैं ये ना करें अपने से. Do not try to self medicate. Do not visit any quack. हमारे स्पेशली हमारे कंट्री में, इंडिया में बहुत सारे क्वैक्स होते हैं who are not certified, who are not qualified enough to treat these diseases, and people would generally go to them. So instead of going to them, instead of going to a local pharmacist who just gives out any antibiotic, कोई भी दवाई लेके वो पकड़ा देते हैं, उनके पास जाने की बजाय you always go to a proper practitioner. That is of utmost importance. That is all.
And in terms of contact and all, so usually
Yes.
should we follow like a non-contact thing with the patient?
Absolutely not. No. These conditions, they do not spread by touching. For example, what do we usually encounter? We encounter, say for example, cancer. It does not spread by touching. Or any disease of the throat. It does not spread by touching. Or any infection of the ear. It does not spread by touching. So what we can do basically is when the patient has any cough or cold or infection of the airways, so at that time the person should wear a mask, and that is enough. The person should not, I mean, there's no problem in being in the same room or being in in close contact with the person. Just that we can wear masks, and that is good. That is good enough.
And
These are absolutely non-communicable diseases, and they do not spread by touch.
और अगर हम आँखों की बात करते हैं, let's say there are diseases related to eyes as well, तो एक I don't know, I mean, मतलब ये this is something that even I am asking you. Some people say that you do not rub your eyes and then do not look at the eyes.
That is correct.
So
I'll tell you why. See, because on the tip of our fingers, there are so many bacteria that we cannot see. And they're very, very small. It is not possible to look at them by the naked eye. And they're always present, no matter how much we want to wash our hands and how much sanitizers we apply. They decrease in number, but we can actually never get rid of them. So when we take our fingers, which we touch everywhere, और हम वो फिंगर लेके अपनी आंख में लगा देते हैं, आंख को रब करते हैं, तो we are actually spreading that infection from our finger to our eye, and that is how it works. So those are precautions that we have to take, not to
And
contaminate our eyes or any of the other organs via contaminated hands. Not touch them.
I think this goes for other organs as well. Of course, I mean, you shouldn't be touching your, face as well, or
Absolutely.
any.
Yes.
Hmm,
That goes for everything. It's a malpractice in children also. At times, you would see that they, suck their thumbs.
right.
Children have their habits of sucking their fingers or thumbs.
Hmm.
So that is again a problem, because the hands are always dirty, right? They keep on touching everything, and then they would take it in their mouths and they would keep on sucking. So all the bacteria and the germs, they would get inside of you. That is all.
And what about eye contact? For example, if somebody is suffering from, any eye
No,
disease.
that's a myth.
Oh,
No,
thank
conjunctivitis does not spread by eye contact. No.
you. Because while we were kids, we were told उसकी आंखों में नहीं
I
देखना.
know, I don't.
Right.
I know, yes. Been there.
Yeah. So okay, that's I think the major truths
Yes.
that you revealed. Um,
Yes.
Other than this, then what are, I think you already talked while we were discussing, but then some lifestyle changes or some things that you would suggest for avoiding all these problems that usually occur.
Yeah, definitely. So, there are certain lifestyle things that we can adopt
Mm-hmm.
to decrease our chances of developing these things. Number one, I think each one of us would know, quitting tobacco chewing and quitting smoking are the paramount. These are the basics of avoiding any type of cancer, because they predispose not only to oral cavity cancers.
Mm-hmm.
सिर्फ मुंह का कैंसर नहीं होता स्मोकिंग और इन चीजों से, बॉडी के ऑलमोस्ट हर ऑर्गन का कैंसर इज एसोसिएटेड विद स्मोकिंग. नंबर टू, आप अल्कोहल कंजम्पशन जितना कम करें उतना अच्छा है. एक और मिसकंसेप्शन जो सोसाइटी में बहुत प्रेवलेंट है कि अपेरेंटली देयर इज अ सेफ लिमिट ऑफ अल्कोहल कंजम्पशन. लोग बोलते हैं कि थोड़ा सा लेते हैं तो इट इज हेल्पफुल. इट इज नॉट हेल्पफुल. मल्टीपल स्टडीज हैव बीन कंडक्टेड and they have concluded that no amount of alcohol consumed is safe. They're not safe.
Okay.
Right? So we have to minimize it. Then, of course, some other factors, like there's a thing called reflux disease, right? When the acid of the stomach, हमारे stomach में acid होता है जो कि बाहर ऊपर की तरफ आ जाता है.
Hmm.
तो उसके लिए हम जो lifestyle factors avoid कर सकते हैं या lifestyle modifications जो हम कर सकते हैं, they include, we should have our meals at least 3 hours before bedtime. खाना का जो रात का जो डिनर है वो रात को सोने से 3 घंटे पहले कर लेना है. मतलब डिनर करने के 3 घंटे बाद तक we should not lie down. लेटना नहीं है. We should avoid very spicy or hot food. Continuous, when we consume these foods, there is more chances of having reflux of acid from the stomach in our throat, और गले में आता है. Then we should also, when there is, we should also be aware of reduced hearing of a person. When we say that a person has started to develop, hearing loss, at that time only we should go and consult. Apart from that, we should not allow water entry into the ears.
Mm-hmm.
For person who are suffering from any ear disease. Water entry in the ear should not be allowed. Means, of course, when we take a bath, so the ears would get wet, right? We have to ensure that ears are always, completely, we clean them with a cloth and then they are dry.
Mm-hmm.
They should not be wet. All right. So these are the precautions that we should, or lifestyle modifications that we should do. Of course, we should inculcate yoga into this because it helps with all the, it helps you in general. It helps with a better breathing, with better weight management. Also, allergies. For allergies, there are certain things that we can, do in our daily routine lifestyle that is helpful.
Mm-hmm.
First of all, we should understand why does allergy occur in the first place. So, हम जिस बिस्तर पे सोते हैं और जिस पिलो पे सोते हैं उस बिस्तर पे बहुत सारे छोटे छोटे माइट्स होते हैं. दे आर कॉल्ड डस्ट माइट्स. मतलब छोटे छोटे कीटाणु होते हैं जो कि हमारे बेड्स पे होते हैं और ये हमेशा होते हैं, हर जगह होते हैं. वी कैन नॉट गेट रिड ऑफ देम कंप्लीटली. सो रात में जब व्हेन वी स्लीप ऑन द बेड, सो दीज आर इनहेल्ड. ये रात को हमारे बाय नोज हमारे अंदर जाते हैं और कुछ लोगों में ये एलर्जी का रीजन बनते हैं. स्पेशली जिन लोगों में मॉर्निंग में बहुत ज्यादा छींकें आती हैं, जिन लोगों को सुबह सुबह, मेजॉरिटी ऑफ द टाइम्स जिनको एलर्जी होती है, when they would wake up, सुबह उठते ही 15, 20, 25 छींकें आ जाती हैं इनको एक बार में.
Hmm.
तो these are those people who are allergic to house dust mite most commonly. इसका सबसे सिंपल तरीका ये है, अपने जो बिस्तर के हमारे जो चादर होती है, जो बेडशीट्स होती हैं, या जो हमारे पिलो का कवर होता है, we should always wash them in warm water every week or every 5 days. Every 5 to 7 days, we should wash them, and then we should dry them out in sunlight. Expose them to the sunlight. Also, हमारे घर के जो pillows होते हैं, जो curtains होते हैं, curtains have to be changed every 2 weeks. क्योंकि curtains के ऊपर भी dust accumulate होता है, और dust again, that dust leads to all these allergic things. Also, since you asked about lifestyle changes, so using masks is a very, very good habit. When we use masks, so we can easily avoid the outside dust to go from going inside our body, right? अगर dust नहीं जाएगा, तो there are very less chances of allergy.
But
That is how we can
I would
take
like
care of it.
yeah, just to interrupt you here. So we saw certain, certain studies saying that masks actually had been impacting health. So are you saying that while we are going out, yeah, or you are saying that we are
What
going
kind
out?
of health?
Mm-hmm.
What kind of health was it impacting?
So what we
What exactly
okay,
was it
so
doing?
I don't know. I mean, I do not really have the data, but what we usually what we studied or what we actually could see was that they said that while you're wearing mask for a longer period of time because of the
Yes,
sweat accumulation and
yes,
everything.
exactly.
Yeah.
Exactly. So, very simple way of taking care of it is you change it often,
Okay.
right? So when this is simple as wearing fresh clothes every morning. We do that, right? We wear always washed and ironed clothes. We'll never wear something that we've been wearing for the past 1 week.
Right.
So same as the mask. See, actually, masking acting as a filter. It is not. It will stop anything from going inside your nose from the surroundings. So of course, it is expected that after a while it will get dirty, right? So when we use the correct type of masks, which is N95 or even a three-ply mask, that is also sufficient enough for routine use. They are good enough, and they are actually helpful in preventing allergies and dust exposure.
And one more thing
Yes.
that while we are talking of allergies, so there are seasonal allergies also that people undergo, bronchitis or allergic bronchitis, or there might be others as well, of course. Uh, what are the different ways and what kind of common allergies that people usually get because of the change of the seasons, and then what things to follow during that? So, for example, pollen allergy is
Yes.
very common.
Pollen allergy is very common, absolutely correct. So these people are usually, they're more predisposed to develop allergies. देखो एलर्जी का रिस्पॉन्स हर बॉडी का अलग होता है. हो सकता है कि मेरी बॉडी को एलर्जी ना हो या मेरे साथ में कोई हो उनको हो जाए विद द सेम स्टिमुलस. So everybody's each body responds in a different way to any allergen exposure, right? So what we actually can do is we actually should limit ourselves for that period from dust exposure or pollen exposure, especially in large open areas जहाँ पे when we open the windows, the pollens come in via the air current. So हम जब खिड़की खोलते हैं तो हवा के साथ में वो छोटे छोटे pollen जो होते हैं वो आ जाते हैं घरों में, and then they cause allergy. Then people are allergic to their pets जो होते हैं, pets के जैसे dog है घर में, तो उनके कोट में जो उनका स्किन होता है, जो उनका कोट होता है, उसमें छोटे छोटे पार्टिकल्स होते हैं जिससे हमें अगेन एलर्जी हो सकती है. So these things have to be taken care of, and since you mentioned bronchitis, so that is a severe form. Allergy can manifest itself in multiple forms. किसी को सिर्फ जुकाम होकर रह जाता है, किसी को गले में दिक्कत होती है, किसी को और ज्यादा दिक्कत होती है, तो लंग्स में ब्रोंकाइटिस जैसे इश्यूज भी हो जाते हैं. तो उसके लिए अगेन द फर्स्ट एंड फॉरमोस्ट थिंग इज अवॉइडेंस ऑफ द एक्सपोजर, कि आपको ये पहचानना है कि जो आपका ट्रिगर है वो क्या है और उस ट्रिगर को अवॉइड करना है. नंबर 2, देन ऑफ कोर्स then comes the role of medication. तो मेडिकेशन अगर आप कर रहे हैं लेकिन अगर आप ट्रिगर को अवॉइड नहीं कर रहे हैं तो एलर्जी कंट्रोल करना इट बिकम्स अ लिटिल डिफिकल्ट.
So since we're talking of trigger, sorry, I'm kind of just diving into it. So अब ये trigger को पहचानने की while we are talking of, तो now there are different reasons that you can be, for example, somebody getting allergy maybe just due to some dust mites, but then getting in a season change, so he
Yes.
might take it as a pollen allergy. तो इसका जो right step है, that I'm, क्योंकि एलर्जी के जो symptoms होते होंगे, what I'm they could be rashes, most common, that's what we observe, right? बाकी तो you can tell more कि what are the symptoms, और फिर इसका फर्स्ट स्टेप क्या होना चाहिए, कि मुझे दिख रहा है कि मैं छींक रही हूँ, ठीक है, या मुझे दिख रहा है कि अभी ऐसा कुछ हो रहा है, एंड आई कैन अंडरस्टैंड. Usually what happens is, I'll tell you, from my perspective, from a layman perspective, people usually take uh, anti-allergics like cetirizine or something. उससे you suppress the symptoms and all. But is that a right way, या उसका क्या तरीका होना चाहिए?
That is a very crude way of dealing with it. Actually, problem is कि sneezing is not the disease per se. और जैसे जो एलर्जी के symptoms होते हैं, नाक का बंद होना, nasal obstruction, excessive sneezing, और watering of the eyes, आंखों से पानी आना, गले में mucus आना, तो ये सारी जो चीजें हैं, they are not the disease per se, but they are the symptoms of the disease. The underlying disease is the allergy, right? Allergy means body का response टू दी आउटसाइड स्टिमुलस, जो भी वो पॉलन या वो जो डस्ट मेरे अंदर गया, मेरी बॉडी ने उससे कैसे रिएक्ट किया उस चीज को. तो द इनिशियल थिंग दैट यू सेड कि वी विल टेक अ लेवोसिट्राजिन और समथिंग, डू नॉट डू दैट. आई मीन that is not going to help in the long run. वो एक बार के लिए शायद काम कर जाए, but that is definitely not going to help in the long run. What we can do is, in the nose we can put drops of normal saline, और nasoclear nasal drops के नाम से आता है, that is saline nasal drops, or we can take steam. I mean, in addition to that, we can take steam. What it will do is, so हम जब inhale करते हैं कोई भी allergen और कोई भी pollen, तो it actually deposits on the nasal mucosa. हमारी नाक के अंदर जाके ना वो इकट्ठा हो जाता है, and वहीं से इकट्ठा होने के बाद में वो धीरे धीरे absorb हो जाता है. तो नॉर्मल सलाइन के वॉशेस होते हैं, नाक में डालने की कुछ बूंदे होती हैं स्पेशली, दे विल वॉश दैट थिंग आउट. वो वॉश वहां से हट जाएगा, तो उसका जो एब्जॉर्प्शन है वो भी कम होगा. ऑल्सो दे विल हेल्प इन ओपनिंग ऑफ द नोज.
So steam helps the same way. Okay.
Yeah, steam definitely helps. Steam is a wonderful thing, and steam really helps.
और ये watery eyes and itchy eyes, and these are the common things. So इसका
Yes.
तरीका, because we have an urge to start scratching and itching.
Rubbing, yes,
Rubbing
yes,
it, yeah.
yes.
Sorry.
We should try and avoid it as soon as.
अच्छा.
We should always try and avoid it. Yes.
Okay. And since we were talking of allergies, तो एक last चीज़, I think just a couple of things which I just realized. We are talking of the reflux. GERD is something, right, which is
GERD. GERD. It's called GERD.
Yeah.
Gastroesophageal reflux disease. Yes.
Yes. So is it something common? Because I've heard it in I mean, usually people say that they have GERD. I don't know. I mean, if they say it just for the sake of saying, because maybe it is very common, but or they got it
It is quite
diagnosed.
common.
Yeah.
It is reasonably common. See, there are multiple factors that predispose to GERD, which include, of course, I told you about the lifestyle that we are. See, we are living in a fast world, right? This generation is a fast generation, and we are always short of time. There is so much of stress. So stress predisposes to GERD. Then eating hot and spicy food. जैसे हम हिंदी में बोलते हैं गरम और तला हुआ बहुत मसालेदार खाना. You must have observed after eating something very spicy, कुछ जलन होने लगती है कभी-कभी, है ना, छाती के पीछे. So that is a manifestation of GERD. That मतलब GERD can also present like this. In addition to that, having a type A personality. What is type A personality? Means hyper competitive. Some people are always hyper competitive. They are always stressed with work. They're always, thinking, I have to always achieve something bigger than this. They are also more predisposed. Then there are some anatomical, things. मतलब some कुछ body की चीजें होती हैं which can cause GERD. How does it present? कैसे पता लगता है हमें? So patient को खट्टी डकारें आएंगी. क्या वो बोलेगा कि मुझे छाती के पीछे जो है बहुत ज्यादा जलन बनती है. And classically this would be associated with meals. मतलब खाना खाने के बाद ऐसा होता है. Also smoking causes GERD. Smoking also leads to GERD. Then a patient जिसको ये सब है उसे हमें कुछ टाइम के लिए दवाइयाँ देनी पड़ती हैं, and they would resolve, and it usually would resolve if you are compliant with your lifestyle modifications and medications, it would go away.
Okay, makes sense. तो बेसिकली आई
Yes,
थिंक प्रिवेंशन इज बेटर देन क्योर, so वो लाइफस्टाइल चेंजेस इफ वी कैन डू,
absolutely.
तो वी
And
कैन.
since you also mentioned about any, you were asking about lifestyle changes.
Right.
So pertaining to ear, we can do certain things. See, in our generation, we are all accustomed to using, noise cancellation earphones, right?
Right, I
As
was
a
about to
high-end
ask you.
music
Yeah.
systems. Yes, so we all have as a high-end music systems in our homes, and we're continuously exposed to all kinds of noise. So these, in the long term, they predispose us to something. Now our ear has three parts: the outer ear, there's something called as middle ear, and then there is inner ear. So continuous exposure to loud sounds can cause loss or hearing loss due to the involvement of the inner ear. हमारा जो अंदर का पार्ट है कान का, that gets weakened, या हिंदी में कहते हैं इसे कि कान की नस की कमजोरी हो गई. तो नस की कमजोरी होना it is on an increasing trend nowadays, because all of us are now, we're more predisposed to having earbuds in our ears almost the entire day, right? So we should try and avoid that. We should not, first of all, we should not use the noise cancellation earphones. They are very good to hear, but in the long term they cause so many side effects. They cause something called as tinnitus, मतलब कान में आवाज आना, कान बजने की दिक्कत होना, जिसे हिंदी में कहते हैं. कान में साए साए की या टी टी की आवाज आती है, ऐसा लगता है कि कान में घंटी बज रही है. एंड इट डज नॉट गो, इट इज ऑलवेज देयर. आप जब सो रहे हो तो भी आपको कान में आवाज आ रही है. वो आवाज कहीं बाहर प्रोड्यूस नहीं होती. वो आवाज सिर्फ आपका कान सुन रहा है और आपका ब्रेन इंटरप्रेट कर रहा है. वो आवाज कोई एक्सटर्नल सराउंडिंग में नहीं होती, अंदर ही जनरेट होती है, और वो एक तरीके का एबनॉर्मेलिटी है. दैट इज नॉट अ नॉर्मल थिंग टू हैव. सो कंटिन्यूअस एक्सपोजर, अगर हम लाउड साउंड से या जो हमारा ये जो है क्या बोलते हैं, लाउड एक्सपोजर टू म्यूजिक और लाउड साउंड्स, दे प्रेडिस्पोज टू tinnitus.
तो ये नॉइज कैंसलेशन ईयरफोन्स आर यू सेइंग कि बिकॉज
They,
ईयरफोन्स,
yes, they are.
I mean, in today's, the age we are living in, of course, we are accustomed
Yes,
to that kind of lifestyle that
we
we
have
have
to.
to use. Yes.
There's no running away from them, right?
Yes.
So that is a thing that we have to take with a pinch of salt. What we can do actually is, we should, if we are, suppose we are living in a room where we are alone, right? We're staying alone. So instead of using a noise cancellation earphone in my, ear, I can just just do my work on loudspeaker, right? Number two, instead of using both the ears, instead of exposing both my ears at the same time, can I use one earbud at the same time?
Right.
Right? Number three, आपके फोन में भी एक वार्निंग आती है जब हम वॉल्यूम को बढ़ाते हैं. तो उसमें कभी कभी लिखा हुआ आता है कि लाउड नॉइस कैन इम्पेयर योर हियरिंग करके आते हैं, बट वी ऑलवेज टेंड टू इग्नोर इट. सो we should try and if we are using both the sides, we should try and use less volume for hearing. And if possible, we should give breaks after every, say, 1 hour. We should give it a break of say 15 minutes or 30 minutes.
अच्छा, इससे
That is very important.
I mean, I just realized one more thing which is very common. So people have this tendency of even if let's say they're not listening to anything or they're not talking, but they still have those Apple में, in fact I think सब में common है that we just plug in the earphones all day long. तो ये is it something that we have to avoid कि आप क्योंकि कान को
If it is not required, why would you plug it in? There's no point in in keeping it plugged in
Okay,
if
so
we are
while
not
let's
listening
say
to
I'm
music.
driving and कोई लंबा ड्राइव हो गया या मुझे कहीं जाना है, तो what I know is कि it's easier for me to.
See, there's no problem as such. Okay. There's no problem as such with by just having the device in your ear. That is okay. I mean, if you want to have it for maybe 1 hour or 2 hour or for that time duration, it is fine. It is okay. But try the volume exposure actually. So we should try and minimize it.
तो मतलब basically the problem is with the volume. तो but yes, better
Yes.
है कि we prevent using earphones जितना हो सकता है, right?
Correct. Yes.
अच्छा, इसके बाद we talked about you mentioned about this thing cotton buds, not using cotton buds,
Yep.
right?
Earbuds, yes, earbuds.
Sorry, earbuds. So अब
Yes.
इसका what is the use then? I mean, let's say ear में अब
See, please
so
complete the
my
question.
question was कि there is a thing called cotton buds which as per a layman are the hygienic these fall under hygienic standards, you know. So you have to keep your ear clean all the time, and every day you while you come out of the shower you have to, you know, clean your ears. तो अभी ये क्या है कि you said that ये earbuds का you shouldn't use. तो क्या तरीका है? Where are we going wrong?
Actually, I'll tell you what. It is a big misconception, right? They are marketed as hygiene products, but they are often not required.
अच्छा.
See, um, our body is created in a way that यहाँ पे अगर आप हाथ लगाओ तो हमारा ये जॉइंट है जिसे हम कहते हैं टेम्पोरोमैंडिबुलर जॉइंट. सो ये हमारी जो बोन है इसका नाम है मैंडिबल, और ये ऊपर जहाँ फिक्स होती है यहाँ पे एक जॉइंट बनता है. हम जब भी बोलते हैं या च्यू करते हैं तो हम अपनी मैंडिबल को हिलाते हैं. फॉर एग्जांपल, आई एम मूविंग माय मैंडिबल टू एक्चुअली एबल टू बी एबल टू स्पीक, राइट? So by movement of this joint, the wax which is inside the ear, it automatically comes out.
अच्छा.
The nature has made our body in a way that the wax almost always comes out of its own. Of course, there are certain exceptions. जैसे अगर कोई कनाल बहुत छोटी है, हमारा कान बहुत ज्यादा छोटा है, या कोई अगर और issues हैं, कभी कभी नहीं आएगा बाहर. लेकिन as a rule, in the general population, the wax almost always comes out of its own. So putting actually, when we put the earbud inside, it will actually push the wax further in. It will not clean it.
Mm-hmm.
You suppose there's a cylinder, right? And you are putting in one stick into it. So it will actually, cause further impaction of the wax. अगर wax बिल्कुल सूख गया है, बिल्कुल जम गया है, तब कभी-कभी समझ में आता है. Otherwise, there is no point of using a earbud. Rather, ईयरबड से जब हम थोड़ा सा फोर्सफुली क्लीन करते हैं तो कान के अंदर की जो स्किन है उसका ट्रॉमा होने का चांस बहुत बढ़ जाता है, और इट कैन ऑल्सो कॉज लीड टू ब्लीडिंग ऑफ द ईयर. तो मेजॉरिटी ऑफ द टाइम्स ईयरबड्स आर नॉट रिक्वायर्ड except for exceptional circumstances, which is very rare, I would say.
So this brings me to another question, since we are talking about ears. So what to do when my ear is itchy?
Ear is itchy. Right. So ear is itchy. The reason of ear being itchy, there can be multiple factors. Mm-hmm. So number one, in this season, especially this is rainy season in India, right? So the ear tends to get itchy because of development of fungus inside it.
Okay.
Little bit of fungus debris will get collected and it will feel itchy. Fungus का आ जाना एक common कारण होता है जिसकी वजह से ईयर में इचिंग होती है. नंबर टू, अगर कान के अंदर हल्का हल्का पानी भर गया तो भी कान भारी लग सकता है या खुजली हो सकती है. या फिर some people are just habituated. Some people are just they get relief when they stimulate their ear using a cotton bud. So that itching part actually is if it is fungal तो उसका हम इलाज अलग करेंगे. अगर फंगल है तो उसकी दवाई अलग होगी और उसका प्रॉपर हमें जो फंगल के अंदर डेब्री बनी हुई है उसे रिमूव करना पड़ेगा. दैट विल बी डन ओनली बाय ऑफ कोर्स ENT प्रैक्टिशनर. नंबर टू, if it is just due to the person is habituated, then and if you really want to itch your ears, then you can always do it mild in a very mild gentle fashion. Never be too harsh when we are using an earbud, because that will cause trauma. Definitely.
Okay.
Right.
So I think most of the things are clear, and while we are talking of itchy ears, so some people have developed different techniques, for satisfying that itch. So some people try to just pull it in and out and all that. So are these practices?
Yes, you can do that if that works. I mean, if somebody sort of can satisfy themselves or himself using this, so it is good enough. There's no problem with that. Just do not poke anything inside unnecessarily. That is not done.
And अब ये जो itchiness होती है ear की, eyes की, इसको कितनी देर तक, like what are the अब just coming to, we understand कि कोई भी problem है, then of course we have to go to a
also since you mentioned itching, I would like to say one thing, that itching can be there due to eczema as well. Eczema is a condition of the skin. Eczema को हम हिंदी में खुजली बोलते हैं. तो this can happen due to a lot of dermatological problems. मतलब स्किन में बहुत सारे चीजों की वजह से, एलर्जी की वजह से या किसी और दिक्कत की वजह से हमें इचिंग होती है, और वो जरूरी नहीं सिर्फ कान में हो, बॉडी में कहीं पे भी हो सकती है. तो ईयर में भी एक्जिमा हो सकता है. तो एक्जिमा कैन आल्सो बी a thing which for which we might feel that we have to itch our ears, but that is also not that common. So when
Um,
it is there, we have to consult a doctor only. We should not try and see if itching is mild and it is occurring only sometimes. Then it is fine. We can sort of self medicate. But if it is persistent or if it is too much, you should always go and see a doctor.
fair enough. So इसी के लिए what I was asking was कि okay, I mean, so basically you'll have to understand yourself कि is it recurring or is it just once in a while kind of thing that you are going through.
Yes.
Yeah, I think we are almost covered with all the topics, and pretty much these are certain topics which, I mean, even I was enjoying it because a lot of things I had been taking things wrong seriously. So but I guess the last question to you would be anything that you would want to give as an advice or suggestion to general audience um, about, I think we talked about lifestyle changes, we talked about allergies, ईयर का हमने डिस्कस कर लिया, ठीक है, वी डिस्कस्ड अबाउट आइज एज वेल, बट एनी अदर थिंग दैट यू वुड वांट टू, जैसे टू मी लेट्स से एज अ टू लेमन बेसिकली अ सजेशन और गाइडलाइन एज अ डॉक्टर.
I mean, the first guideline would be जैसे एक कहावत भी है हमारे में कि a stitch in time saves nine, right? So the earlier we diagnose and treat a disease, more are the chances of success. So that goes for almost every single thing. If we allow the disease to progress, it definitely will progress. हमारे ignore करने से वो खत्म नहीं हो जाएगा. So we have to ensure that we are seeking help at the earliest. And also, of course, you can spread this video and more people actually can, the basic points that we discussed before, people can see and act accordingly. As a societal thing, we should avoid going to quacks and people who are not qualified to treat the condition. Also, these days, internet is a very common source of information, right?
Exactly.
But the problem is, that is the biggest misleader that can actually be there. So it is a very we're living in a world. It's a dilemma. It's a big dilemma.
That's why,
Actually,
I
to
mean,
seek
I
help
think,
online or not, right?
yeah.
So they will, and we don't know the correct sources to access information on the internet. So if you want to seek medical help, medical access agar chahiye, to the correct sites would be PubMed. PubMed is a site which has actually all the articles or the journals upon which which are the result of all the latest latest research and all. So if you want to have information, you have it from PubMed. Otherwise, just Google it, because that will actually confuse you more rather than solving the problem. The easiest way still is to actually visit a specialist in that area.
Yeah, that's the problem. I think everybody tries to become a doctor themselves these days because of
People
Google.
would come with their set of notions. So I've personally had this issue that A, we have to counsel them about the disease. B, we have to counsel them of the preconceived notion that they are bringing along with them.
Yes.
Right? कि मैंने तो ये पढ़ा था, आप बताओ. तो मैं उनको समझाता हूँ कि भाई ऐसा नहीं है. Google is not the doctor, right? So that is something that we have to take care of. Yes.
But I think so yeah, I think this was a very informative session. We would actually publish the links as well as you suggested, in the
That will
description.
be that will be much that will be very helpful to the general population also, and I hope to everyone who watches it. And if any clarification or any need is there, I am more than happy to help.
So thank you, Dr. Sanjay Soni, for volunteering for us, and we wish you all the
Thank you
best.
so much for having me here.
Thank you.
Okay, bye bye.